We're gonna go ahead and get started, though we will definitely have more folks joining us as we continue into the hour. Good afternoon, my name is Ryan Jacoby and I am CNE's Deputy Director of Operations and Advancement. My role today will be helping to manage the clock and to facilitate questions and comments getting to our panel. I want to start by welcoming all of our attendees, which include nonprofit leaders, funders, community partners, media representatives, and elected officials, and thank each of you for joining us. We hope that each of you is healthy and well given the circumstances, and we're grateful to you for taking the time to be with us today. We'd also like to thank the more than 100 organizations that took the time to complete our survey and feed the results that we're about to share with you. We will be including an infographic of the data that's presented today in a follow-up email to participants, and we'll be posting a full report and recording of today's virtual town hall on our website soon. I want to quickly highlight a few Zoom guidelines that will hopefully help to ensure a smooth conversation. So to help us know who's here with us, please try to set your Zoom screen name to show your first name and your affiliation, and if comfortable, your preferred pronouns. To do this, you can open the participants window at the bottom of your screen, hover over your name, and you should see a blue button that says More. Click this and you'll see an option to rename. Also, all participants are muted as a default, not to silent folks, but to ensure that we can cover a lot of ground over the next hour. So we encourage you to please open your chat window at the bottom of your screen to add any questions or comments you would like to share, and also to track other folks' questions and comments. We will do our very best to address all of them today, and if we're unable to, we commit to following up with responses to all questions. I'd like to briefly introduce our panelists who you'll hear from shortly. Justin Reed is Director of Community Initiatives at Virginia Humanities and a CNE board member and co-chair of Project Rebound's Arts and Culture Recovery Committee. Michael McKee is the CEO of the Blue Ridge Area Food Bank and a CNE board member. And Charlene Green is Deputy Director with Piedmont Housing Alliance and co-chair along with me of Project Rebound's Nonprofit and Community Organizations Recovery Committee. And now I'm pleased to hand you off to our Executive Director, Cristine Nardi.
Thanks, Ryan, and thanks again to all of you for making the time to join us today. We are here today to talk about nonprofit needs during the pandemic. But as we all know, nonprofits work with and serve people and communities, and in many cases, they're lifelines and on the front lines, working with our most vulnerable citizens. Of course, local government, county agencies interface day in and day out with residents as well through local public schools and public housing authorities and public benefits. But be clear, if you leave nonprofits out of the response equation, let's just acknowledge it, there would be huge gaps to fill. So nonprofit needs are really a bellwether of our community needs. We recognize that there's no one-size-fits-all nonprofit, and nonprofits can't and don't operate in a vacuum. They must and do partner with local government, businesses, funders, and importantly, clients and people with lived experience to tackle real challenges and community-wide solutions all the time, but particularly during this crisis and in recovery. Nonprofits can't do this if they are not viable businesses. A little bit of context here. The nonprofit sector represents 9% of private employment in Virginia and collectively exceeds payrolls of most other industries, including construction, finance, and transportation. Nonprofits are taxpayers. We pay tax on salaries, we pay sales tax. Nonprofits attract other employers by providing a strong and healthy quality of life, and we spur economic activity, just for an example, through arts and culture. Nonprofits consume goods and services like medical equipment to office supplies that create other jobs. And nonprofits create work opportunities beyond those that they employ. They are often caregivers for our kids and supporters and caregivers for our most vulnerable populations. So families can work. Nonprofits also provide job training and workforce development. So if you think about it, all of us either work for, volunteer, or are served by a nonprofit. So nonprofit economic viability really matters to keeping our neighbors employed and our communities thriving. So let's dive into the survey data. We're going to start with a background slide for the survey results. These results reflect almost a 2-month period, roughly equating to the governor's stay-at-home order, and the answers that we received have been consistent throughout that time period. They also reflect nonprofit needs survey data at the state and at the national level. So in the next slide, you'll see the various mission areas of the nonprofits who took part in our survey. You'll see that human services and arts and culture nonprofits have the highest representation in our survey results, with education, workforce development, and health coming in next. The other category includes topics like advocacy, capacity building, financial stability and access to capital, and animal welfare. On the next slide, we've created just a word cloud for you all to see a quick visual of the organizations that took the survey. And I want to stop for a second and welcome those on the call from across the state. Wherever you go, our sector is predominantly represented by small and medium-sized businesses, often under $1 million. For comparison, the C&E portfolio of members, we have about 320 members. 78% of our members have operating budgets under $1 million. So this survey represents a wide range of budgets and staff sizes. It includes grassroots community-based organizations, all the way to multi-million-dollar nonprofits. Before we dive into more of the survey results, I just want to back up the lens a little bit and give you a bit of context. So nonprofit needs, again, are not just for nonprofits. There are critical and, as we know, unprecedented community needs that nonprofits must respond to so our communities can be resilient and strong through this crisis and into recovery. Many of you on the call today experience that overwhelming need every day. And so sharing just 2 bullet points for you around context. The first is this unemployment statistic. It's from the Bureau of Labor Statistics, and it shows an increase of 10.3 percentage points in April, the highest rate and the largest over-the-month increase in the history of the series since the Depression. Here, just in the greater Charlottesville region, an estimated 15,435 people, or 12.3% of the working population, are currently unemployed. The second data point I want to highlight is a point around inequity. So we know that to date, there have been 80,820 COVID-19 related deaths. Those are more than the total combat deaths in the Vietnam War and the annual death rate for diseases like Alzheimer's. It's concentrated, of course, because the effect has been, as Dr. Fauci has told us, truncated in weeks. What we do know and what we are seeing is the coronavirus is infecting and killing Black people in the United States at disproportionately high rates, according to data released by several states and big cities. Highlighting what public researchers say is really an entrenched inequality in resources, health, and access to care. So early research shows us that communities of color are experiencing disproportionate and compounding effects of historical inequalities. Just for example, people of color receiving unequal health care and treatment. Low-income children and seniors often cannot access digital services. Homeless populations cannot shelter in place safely. Persons with disabilities may not be able to access certain technologies to receive services, and persons involved in the criminal justice system are experiencing delayed cases or higher health risk. Persons who are of immigrant and refugee communities are experiencing further isolation. So these 2 points are really important as we think about the needs of nonprofits and the work that nonprofits do in the community, which crosses all of those different categories that I just spoke of. So let's get to the data. The nonprofit needs survey data is not an anomaly, as I said. The data is consistent with 3 national and 2 statewide surveys that we reviewed with similar questions. The first slide starts with nonprofits are experiencing destabilization due to the COVID-19 crisis. I've heard this described for everyone, not just nonprofits, as business as unusual. What we know and are starting to understand is that the damage is likely enduring and that the future is deeply uncertain. So what does that look like for the nonprofits that took our survey? You can see here some statistics around the struggle that nonprofits have and are facing in a destabilization of the resources that they need in order to do the work in the community, whether it's philanthropic or earned revenue resources. And some either have laid off or are already anticipating laying off staff. One thing that's interesting to point out is it's been considered really a settled leading practice that nonprofits do their best to diversify their revenue when they can to protect against philanthropic ebbs and flows. But those who have done that, who have both philanthropic income as well as earned revenue, are experiencing a 1-2 punch in this crisis. In many cases, disaster philanthropy is increasing for those nonprofits that are on the front lines, but the increase is not holding true across the nonprofit sector. And earned revenue, as we know, has been completely circumscribed because of our social distancing requirements. The good news is that while nonprofits have limited operating reserves to protect against destabilization, they do have operating reserves. So let's just look at this slide. I was excited to see the report back that 75% of those nonprofits who took this survey have an operating reserve. That's great news and really is an example of healthy business practices. But another settled practice around operating reserves has been that there's no clear answer as to how much operating reserves you should have, but it's really important to try and have at least 3 months of reserves, as many nonprofits do, as you'll see on this slide. But that no longer seems anywhere close to sufficient. So 75% of all of our respondents indicate that they have an operating reserve, 63% have 3 months or less, and 21% have between 4 and 6 months. That's an important statistic to consider when you're thinking about the timing for when we support nonprofits financially in order so that they can survive this crisis and thrive into recovery. So as a result of that, nonprofits, just like for-profit businesses, are stressed by business interruption and increased client demand. And we have a slide here that shows some of the major disruptors in the nonprofit business space. So what makes nonprofit disruptors unique? Well, first, many nonprofits, if not most, survive and thrive only with volunteer support. And as we all know, there are many fewer volunteers, in-person volunteers in the nonprofit sector. And many of our volunteers tend to be older, often, and in some of our most vulnerable populations. So that's a real disruptor. There are changes to the business model, as I talked about. Often there's an increased demand for services, and there are both earned revenue and donated income drops. So all of those are factors that are disrupting nonprofit businesses, making it harder and making it really challenging for them to provide the community support that they do on a day-to-day basis. So what do nonprofits need? No surprise, they need rapid and comprehensive business and financial support. Government, funders, and capacity builders to act quickly with dollars, resources, and importantly, advocacy support. This next slide shows what nonprofits have articulated that they need the most in the short term. It's really a snapshot from the early stages of this crisis to this week. And so what you see is nonprofits identifying that some of them need short-term financial support and funding, and those would largely be those nonprofits that have very limited reserves. And others need support and guidance to figure out how to adjust to a new way of doing businesses, both because of the people we employ as economic engines, but also, and most critically, because of the people and the communities we support. So here are just a few examples of what we heard in our survey in terms of the destabilization that nonprofits are facing. Financial and supply donations are severely down and struggling to keep up with demand for services. On the other hand, we've had to shutter the building, cancel or postpone all of our revenue generating programs through May and possibly the summer, and are having cash flow issues. So we're fortunate to have here today 3 nonprofit leaders who are going to share their on-the-ground insights. Before they do, though, I thought we might stop and see, Ryan, if you've gotten any questions that we might be able to answer around the data.
We do not have any questions at this time.
Okay.
Yeah.
So let's shift to on-the-ground insights. We decided to lead today with survey responses, but we wanted to give you more dimension more three-dimension, if you will, to the needs from the perspective of nonprofit leaders. And we have nonprofit leaders who are engaged in arts and culture, who are doing frontline work through the food bank, and who are focused on affordable housing. As Ryan mentioned, two of our panelists, Justin and Charlene, also can share highlights from Project Rebound, which is a Charlottesville region initiative to identify actionable strategies to rebuild the economy. They're leaders of, respectively, the nonprofit and community organizations and the Protecting the Arts and Creative Economy committees. Justin also has insight from recent Virginia Humanities CARES Act grant application process to distribute federal stimulus relief funds to arts and culture organizations across the state. So without further ado, I'm going to turn it over to Justin.
Can you hear me okay? All right, great. Well, Cristine and Ryan and the entire CNE staff, thank you for having me and allowing me to be a part of this important town hall conversation. I think CNE's survey results support the data that Virginia Humanities has collected. We did a mid-April survey, and we looked at Virginia museums and cultural organizations all across the Commonwealth of Virginia. And I guess I should just back up and say, for those of you who are unfamiliar with Virginia Humanities, we're the State Humanities Council. Every state and US territory has a nonprofit State Humanities Council, and we were all established by the National Endowment for the Humanities, which is a federal agency. And Virginia Humanities is headquartered at UVA and serves the entire state. And we primarily serve the state through our grant making to local history and cultural nonprofits. We also produce our own public programs and educational content like Encyclopedia Virginia and With Good Reason radio show. We also help produce the Richmond Folk Festival. And I should say, I really credit our Center for the Book for being the canary in the coal mine when it comes to COVID-19 here in Virginia. Many weren't taking it seriously back in early March. And when our Center for the Book made the hard decision to cancel the Virginia Festivals of Book, I feel like it really helped wake the entire state up. It was Virginia's first major event cancellation. And I think this is part of a long tradition of the arts and culture community, almost serving as the moral conscience of many of our communities. Since that time, Virginia Humanities has almost taken, we've taken like this relief agency role. We've awarded over $40,000 to local booksellers and schools in Charlottesville, Norfolk, Arlington, Richmond, Roanoke, and Harrisonburg, so that free books can be provided during school lunch deliveries. We've also awarded another $600,000 in NEH CARES Act relief funding to organizations all across Virginia. And we know that this doesn't come close to what these groups and organizations actually need. The nearly 200 Virginia museums and cultural organizations that responded to our survey reported needing around $3 million to maintain staff and operations for the next 3 months. And 42% said they had less than 3 months cash reserve. The nonprofit arts and culture community is essential and it's vital and it's clearly struggling. And I think we're also struggling to really share just how vital we are and how much help the arts and culture organizations truly need right now. If you think about kind of this human hierarchy of needs, you know, we've understandably placed ourselves behind housing and food, right? And I think you're seeing many transition to online virtual programming in the hopes that, you know, if we just keep audiences engaged, they'll eventually remember us and eventually get around to donating to us. But I think it's important to view arts and culture not as part of this kind of hierarchy of needs, but really this integrated web of needs. You know, they support our health and wellness. I mean, there's countless studies and research that show how the arts and cultures and humanities support physical, mental, and emotional well-being. You know, we support education, especially place-based and project-based education when it comes to our museums and cultural heritage sites, interdisciplinary learning, creative thinking. These are all things that are supported by the arts and culture sector. And we also play a critical part of the local economy. When you think about job creation, we think about economic development, we think about tourism revenue. In Virginia, the tourism industry generates $30 billion annually, around that amount, and about $1 billion of that is here in the 8-county Charlottesville region. The arts and culture and tourism industry also supports over 10,000 jobs in this area. So truly the nonprofit arts and culture community is foundational to our ability to thrive as a community. We have a private sector that largely relies on a thriving nonprofit arts and culture sector. And when we're talking about what happens next and how do we recover, I've been really trying not to use the word recover and really think about how do we rebuild, how do we restructure and ensure that, when it comes to housing, when it comes to food security, we're creating an arts and culture community that makes certain needs no longer something that is precarious, but something that you can truly have covered through our local economy and not through the nonprofit sector. And so I think it's important to really view these things as being interconnected and recognizing that arts and culture is key to a truly thriving community.
Great, thank you so much, Justin. We appreciate the insights regarding the arts and culture sector, so thank you very much. We do not currently have any questions, and so we will transition to our next panelist. For those that were a little late joining us, we're fortunate to have Michael McKee with us. Michael is the CEO of the Blue Ridge Area Food Bank and is also a CNE board member. So take it away, Michael.
Thank you, Ryan. I appreciate the opportunity to join everyone today. Just by way of background, the Blue Ridge Area Food Bank is a regional food bank. We're one of 7 that operate in the Commonwealth. We serve people in 25 counties through 4 distribution centers, one here in Charlottesville. Our main is in the Valley in Verona, and we have 2 more, one in Winchester and one in Lynchburg. Last year, we provided enough food for about 23 million meals, and through our partners, we're supplying food pantries, soup kitchens, and shelters. We provided food to about 103,000 people every month. And to put that in perspective, we're part of the Feeding America network of food banks. There are 200 of us coast to coast, and altogether, we're providing about 5 billion meals a year to about 45 million people across the country. So this is an enormous enterprise. And I think when I consider what's happening in the field today, right now, I think one of the images that is with most of us is what we see on the news. These miles-long queues of cars, thousands upon thousands of people lining up to food banks to receive food assistance. And I think suddenly that's the image that a lot of us have of a food bank. But I think one of the things that is important to understand is that we're seeing these images largely because the food pantries in some of these cities like Pittsburgh and San Diego and San Antonio and Tampa, those food pantries all but collapsed. Not all of them, but as many as half of them, which thrust the food banks into providing direct service to people through those means we've seen covered in the news. And I think one of the things that I really draw inspiration from that we're seeing right now here in our local community is the way that volunteers have stepped up. 96% of our partner agencies, we have 205 food pantries, soup kitchens, and shelters in our network, and all but 9 of them are remaining open and are serving through this. And we're adapting, we're helping them adapt what they do low touch and no touch distributions, get by with fewer volunteers. The volunteer base is largely people in their 60s, 70s, and 80s, the folks who are being told to stay home and stay safe. So I really am inspired by just the rise of volunteers to the occasion here. We have thousands of volunteers who are working with our partners, several hundred who work just for the Blue Ridge Area Food Bank. We've had hundreds of new volunteers sign up just in the last 8 weeks. And that's playing out across food banks all over the country. And I think that the way that the community is responding and coming together is a real silver lining to what is a really dark story. And I think it's really worth noting the strength of the nonprofit sector to pull these people together quickly and deliver such important services in the community. Now, I say that thinking too that the kind of the longer run story here is something a little different than what we can tell through the emergency response of our network. You know, food banks started 50 years ago as food rescue organizations. The idea was to do a more effective job gathering food that would have otherwise landed in landfills and provided that to food pantries, and that all started in Phoenix. And we do a whole lot more than that, but food rescue is still at the heart of our model, and we've got a lot of programs around healthcare and nutrition and children and seniors and the like. But food rescue is at the heart of the food banking model. But it's really not characterizing what we're doing anymore. Just in the last 8 weeks, we've spent about $1.3 million just on food, non-perishable items, let alone everything else that goes into the response. And that's true, again, you know, nationally as well. And we're providing all this food to nonprofits who are amassing volunteers, and they're distributing it to people, dropping food in the trunk of their car at all odds, all odd hours and days of the week. And I'm thinking to myself, this is really going to go long term. And when we're serving 103,000 people a month before COVID, that's still 50% higher than before the last recession. So, you know, think about how much worse this situation is right now. And how much longer it's really going to take to come out of this. It's going to be years, perhaps many years. And so one of the concerns I have is how long can we really sustain this level of intensity with volunteers, predominantly older volunteers, in this network? And does it make sense for a food bank to be spending millions upon millions of dollars per year buying food and distributing it this way, versus the government expanding SNAP benefits and allowing our clients to go to the grocery store and buy food like everyone else? So I think the opportunity here is not just what we're doing in emergency relief, but what can we do to take advantage of this moment to really work for systems change?
That's great. Thank you so much, Michael. We appreciate that. It looks like we do have a comment from Stacy that says, here in Fauquier County, we're seeing the community donating to local bakeries and dairy farms to make bread, milk, and give supplies to food banks. The nonprofit food banks are helping to keep other businesses in business. Is this a business model that can sustain?
I think it's a localized, hyper-localized business model that's important. I think one of the things we're finding through this is the way different local community groups and businesses are finding through innovation different ways of filling the need and connecting people with the services they need. And we see this in restaurants connecting with their suppliers to do CSAs that are sort of improvised at the doorstep of their restaurant. And this is a great example of what we're seeing in the nonprofit sector up in Fauquier, bailing out, not really bailing out, but providing an avenue for farmers to get their products out the door. And I think that's great creative, and it's really something that does need to happen at a really local level.
Great. Thanks, Michael. So we are going to transition. I will pause just to let folks know that we've planned for about 15 minutes of sort of general Q&A at the end for all of our panelists and Cristine. So don't worry, you'll have a chance to hopefully ask some follow-up questions. Last but certainly not least is Charlene Green. Charlene is the Deputy Director with Piedmont Housing Alliance and co-chair of Project Rebound's nonprofit and community organizations recovery committee.
Thank you, Ryan. Good afternoon, everyone. I want to thank Cristine and the staff at CNE for hosting this town hall. Some very important conversations need to happen around what's going on right now in our community. And just to give you a little background about PHA, Piedmont Housing Alliance, We have 11 properties that we manage in 3 different areas in the city of Charlottesville, Albemarle County, and Nelson County. We have a combination of multifamily properties and properties that house seniors and people with disabilities. So we manage units that house close to about 2,000 people. And so I'm going to speak to the ways in which nonprofits might experience some destabilization based on the stats that that CNE presented in the survey, with the first area being around donations and how is that impacting our organization specifically. We've been very fortunate in that we're still continuing to get donations, and so we're shifting those donations in ways that provide support for our residents. So for example, we offered a mini grant opportunity for people to apply. It's a one-time grant per family of approximately $200, and I think I don't know the number of families we have reached totally, but we went through about I believe it was $30,000 in donations as a first round opportunity, and I think we've gotten a second round of donations specifically to help provide money in those mini grants for our residents for a second round of grant opportunities. And they could spend the money any way in which they chose. We also got donations in the way of goods. For instance, with food, we have a number of different organizations that come on our sites. We already had a working relationship with the food bank, and so we're very grateful for that opportunity to continue that. But we also had people donate meals, and so either it was the city schools or the county schools or PB&J, Frontline Foods. Those folks have been very generous in donating meals to our different communities so that people who are struggling can sustain themselves. We've also gotten face masks that we've distributed, and we want to continue to distribute because it's important for folks to have as many masks as possible. And so so the donation piece we've just shifted. We haven't had a reduction that is significant in our revenue just yet. Most of our revenue is generated through rent, and we also get grants and donations, but it's primarily through rent. And we've had some of our residents who are struggling to pay their rent, but because we have folks who get subsidies or they have guaranteed income in other ways, we haven't been hit just yet. I think the longer this drags out, I think we're going to see some reduction, some minor reduction that we're going to have to figure out how to address. In terms of long-term stability financially, a lot of that will depend on how much we can shore up our renters to make sure that rent keeps coming in. And then I think with the staffing piece, we have been very, very fortunate to not have to furlough anyone or let anyone go. In fact, we've been in a position where we were able to offer hazard pay to our management and maintenance people who are on the front lines on a day-to-day basis, working with our residents, ensuring their safety. And as the organization, we're trying to make sure we ensure the safety of our staff. And so providing them with hazard pay has been a gift that we've been able to support them with. It's a model that we hope other organizations are able, if they're financially stable, are able to provide for their staff if they are in constant contact with the community that puts them potentially in danger. And then with Ryan and I co-chairing the subcommittee of community organizations and nonprofits, a lot of the feedback and the discussions we've had are hearing mirrors perfectly the survey results in terms of folks being concerned about safety, making sure that there's a plan in place as we move forward out of the governor's executive order. So those kinds of things are definitely high on everyone's list for the stability of their organization.
Great, thank you very much, Charlene. Let's see, we have a question from Mary for you, Charlene. On what basis was the hazard pay determined? How much contact with the public was deemed hazardous?
Well, our community management staff, which includes the property managers who are leasing agents, they deal on a daily basis with our residents, either with trying to make sure that our units are safe, and that includes our maintenance folks. They have to go in sometimes the apartments to fix things. It was determined that folks who have the potential of face-to-face, like I said, on a daily basis, 7 days a week, for some folks, with their work, deserved to be, for us to show our value of their work and the manner in which they're putting their themselves on the line to make sure our residents are safe and that we maintain their properties, our properties, for their safety and their quality of life.
Thank you. All right, so we are going to kick things back over to Cristine briefly, who I believe is going to introduce maybe a few potential action items for the group to consider. And then, as I mentioned, we've left a good chunk of time at the end for folks to ask follow-up questions.
Thanks, Ryan. So where do we go from here? We decided that we would share some collective and emerging insights, but we hope and expect that we will all continue to develop together the ideas of where we go from here as our health and our economic realities evolve. And we encourage you all to add to the chat box any where do we go from here questions or where do we go from here suggestions, so that we can capture the best thinking of the group here today who've joined the virtual town hall. And we will share those highlights and questions in a follow-up email to all participants. So let me just share with you a couple different suggestions for calls to action. As I mentioned at the start of this presentation, we are experiencing a destabilization of not just the entire nonprofit sector, but of our community. And it's not going to be short term. We are all undergoing rapid change and pivoting to do our best to meet community need as it arises. And what we know is this is hitting nonprofits differently. So we, of course, need our partners in the community, local government, our funders, our capacity builders to act quickly. And here are some suggestions of ways to act that you can see on the screen. I'll highlight just a few of them. Number one, we all need to provide support to nonprofits, to community members, to those who are able and willing to advocate for policy change that reduce inequities that brought us here in many ways in the first place and can help make us more resilient coming out of this crisis. One of the things this survey asked of our nonprofits was if they would report out on feedback they were getting from clients that they were serving. And the report outs included a challenge with the digital divide in not having access to broadband and internet for telehealth and education, not having long-term access to paid leave, access to childcare, a worry about mental health and healthcare access, and challenges with criminal justice reform, barriers to driver's licenses, barriers to housing, barriers to work. And so all of those are advocacy efforts that are required not just now, but into the future so that we can create a more just and resilient community. And so advocacy, we recommend and we think needs to be first and foremost on everyone's mind. And then secondly, it's really important to balance the emergency response needs that we've talked about here today with a preventative and long-term systems response. And so if we are going to support our entire nonprofit sector to weather the storm and to be with us, to continue to partner with us in recovery, we need to consider what that looks like. And I ran across a small description from the Duke Endowment, and that description was the trust first principle. And that really resonated with me. So from the standpoint of funders who are thinking about how best to support the sector, what we've really been gratified by and enthusiastic about and pleased about is that funders have really moved to release restrictions on funding. We know that there are 744 grant makers across the country that have committed to releasing restrictions on funding so that nonprofits can apply the funding as it's needed now, and also to give new general operating support funding. In some cases, we've seen funders give an extra year of funding to create really a deeper partnership and a deeper opportunity to collaborate between funders who are seeing the same needs and wanting to make a difference, and nonprofits who are acting on those needs to make a difference. We've also seen accelerated payments of approved grants. And then for foundations, consider giving more than 5% of your payout rate, the baseline or the floor, because the need for nonprofits and those in the community that they serve is unprecedented. So like in 2008, we're seeing some funders, some foundations tapping their endowments in new and different ways. And then in addition, really making it much more streamlined and easier for nonprofits to be able to access grant funds. So reducing paperwork and providing support beyond the money, helping to leverage other financial support in the community in a collaborative way, soliciting and acting on feedback from nonprofits and other community members to be able to design the best collaborative approach forward. And then from an advocacy standpoint, really, really important to fund and support grassroots, locally grown, community-led social justice movements for change so that we can see changes and see opportunities coming out of this crisis that allow us to operate differently than we have in the past. And so, as Michael mentioned, so that nonprofits can be used differently in the future. And finally, there really is no either or in terms of support of the nonprofit sector. This is a both and moment. We need to respond rapidly to immediate needs and be very, very focused on what it is that our community members are telling us that they need in the crisis. And we also need to invest in nonprofits and people that they serve longer term so that we can sustain our community connections, so that we can sustain the sector that really is the web that knits our communities together as the pandemic recedes, and so that we can rebuild and thrive. So I'll ask, just as people are thinking about this question of where do we go from here, everybody to take a look at this quote. And what we're talking about is the idea that we are going to need to rebuild our community. And rebuilding our community, it's easy to look out, harder to do, but easy to look out and see the physical infrastructure of our community, our food systems, our water, our housing, and identify things that need to be improved for everyone, but particularly for marginalized populations. But we also have to look at our social infrastructure. And sometimes, although it shouldn't be, it's more difficult to see. And that social infrastructure is the trusted network of nonprofits, philanthropic organizations, arts and culture, and local institutions that really help our communities function. So I want to say thank you to all of you for being part of this virtual town hall today, and stop there to answer any questions that have come up or hear any feedback from our group.
Yeah, thank you, Cristine. So we've had a number of questions come in. The first one is from James Pierce. Says, everyone on this call has some type of similar systems change coming. What qualities or characteristics are required of us in order to handle so much change at one time? And that question is to the entire panel.
I would say having a plan. Our staff meets on, some parts of us meet daily. I've become very familiar with Zoom, as we all are, and I think it helps to talk through anything that comes up. So, because there's going to be surprises, but I think having a plan of how we're going to keep this staff safe, a plan on how we're going to keep the residents safe, a plan on, how are we going to address things, not knowing how long this is going to last, that, the plan to deal with the next 2 months. And if we start to roll out of this, what's that plan going to look like? So I think what helps us try to, what comforts us in us feeling good about what we're doing is that we have something in place, and we're willing to be flexible with it.
Thanks, Charlene. The next question is from Trish Clough. With everyone's effort, how are mental health issues being addressed? And are you seeing resources present themselves or a decline in what is available across the constituents?
I can take a stab at that, and good question, Trish. Thank you. I think we have some representatives from the Mental Health and Wellness Coalition on the call. I think that coalition and the mental health organizations that have been working in the community have, not just during this crisis, but over a number of years, really prioritized and focused on collaboration to leverage all of their assets to provide better community support. And that's really coming into its own now, in my view, in terms of the ability to get out across the community what mental health resources are available, and the ability to do that in a way that targets what the needs are during this crisis. And if we can't completely fill the gap, at least avoid the duplication of efforts and services that often happen in a pandemic when everybody's trying to make sure that all needs are met. So I would just give a shout out to our mental health coalition and mental health service providers who are on the call for the hard work coming into this crisis that allowed it to be positioned to really provide valuable on the ground services now and we expect into the future.
So there were two related comments to that. One is from Sarah Miller saying at Camp Quest they had a call with a grief counselor for staff and campers to deal with the loss of the camp community this year, just saying that it was well received. And then Rebecca Kendall is commenting that there are mental health resources available at this time, and with telehealth access has actually improved for some in rural areas who previously had transportation barriers. She goes on to say that nonprofit providers have done a good job pivoting to telehealth services, but the system on the whole was already significantly taxed at a time when there is now increased need. One of the important ways of addressing mental health needs is through peer support within organizations. So thank you, Sarah and Rebecca. The next
Ryan,
question is, yes.
Sorry, Ryan, before we jump ahead to the next question, I just had a thought about, I think it was James's question about how do we figure out how to move forward in what is really an environment of gray, of no real knowns this day or next week or even in the next few months. And one of the things that we've been really focusing on is this idea of adaptability. And I've really been inspired by seeing all the ways that nonprofits have adapted when they've needed to, both to provide in-person services, but also to provide virtual services. And so So there's this idea of, we teach it in our board academy, that every day we have to be focused on what are our fiduciary responsibilities to the organization. We have to be strategic. Those are kind of key markers for board members, but something that we have a hard time getting to, and it's where we are right now and have no escape from, is the need to be what's called generative in the literature. And that is the need for all of us to ask questions of our organizations and each other, the what if questions of what if a pandemic hits, and we have to provide our programs and we have to do our services in a completely different and unknown way. What is our unique value, and how can we make sure to stay close to that unique value moving forward into what will be a gray area for a long period of time? And so adaptable, asking yourselves, being willing to ask those what if questions about throwing the rule book out and seeing if there are things that we need to do completely differently. And the third would be the idea that we always have a responsibility and always are focused on nonprofits and being as strategic as possible. And strategy means matching assets to resources. And really what we have to do is keep on doing that, matching assets to resources.
Thanks, Cristine. So the next question is from Dick Riley, wondering if any of the organizations on the panel have applied for a PPP loan, and if so, what your experience has been.
I can jump in if the other three don't have a PPP loan experience, but I can tell you what C&E's experience has been, but I don't think any experience, there's no one experience. I think it's been incredibly challenging as the federal stimulus relief funds have come down to the local level, in terms of nonprofits really having to go through lenders in order to access PPP funds, and lender availability being different depending on your relationship with the bank. That has been a real stumbling point and something that we're continuing to advocate around in the new federal stimulus relief package that's coming, to clean up all the challenges with PPP to make it more of an actual opportunity for nonprofits of all shapes and sizes, and the ones that need it most to be able to access those funds. And if you have any specific questions about that, we are doing a lot of virtual office hours on accessing PPP funds, and would be happy to talk more off the call.
Great. Next up is a comment from Wendy Brown that says, consider working with trusted partner foundations to develop low or no interest loans to smooth cash flow, or use their balance sheets as guarantees to buy down interest at banks. All right.
Thanks,
And then, did you want to respond to that, Cristine? Okay. Next up is a question from Barbara Kessler. How can we disseminate information to the greater community and our customers on what safe in-person interactions look like? In other words, how do we create community again?
I wonder if those of you involved in Project Rebound might be able to respond, at least with some initial thoughts of those committees who are working hard on this question.
I think for just thinking about what we're trying to do at PHA, but then also the conversations that are happening through our group with Project Rebound, I think it's reaching out to your specific circles in your communities with the assistance of the community members that have some sense of trust, you know, because we give out all kinds of information, and that's expected. And I think as we try to educate our residents on being safe and being responsive to them, it helps when there are other folks in their communities, and whether it's Friendship Court or down in Crozet or over at Park's Edge, when you are also partnering with trusted community members in disseminating that information or trying to model those safety behaviors that we want people to be aware of. It takes folks looking toward people who they trust, who they have the closest relationships with. And we've found that to be the folks who are within their immediate communities. And I would say that would be true in any situation where if you've got a great relationship with the people you're working with, you're constantly communicating with, then they're going to listen closely to you, pay attention to what you have to share, as opposed to just, getting a flyer that says, do these 5 things. The relationship really makes a difference.
Great, thank you, Charlene. I just want to quickly highlight 2 resources that were posted in the chat room. One is from Michael with the Charlottesville Clergy Collective, that he's found to be a helpful triage tool for reimagining strategy within the context of COVID-19. And then Rebecca Kendall first endorses his suggested resource, so I think she's found that helpful. And then she is also wanting to make sure that folks are aware of a website regarding local mental health services. So this is helphappenshere.org/coronavirus. And I will commit us to including both of these resources in our follow-up email, just so everyone has them. And so I'm mindful that we're approaching 4 o'clock. Thank you for hanging with us. I am going to send it back over to Cristine to take us home. Oh, you're on mute, Cristine.
There we go. Thanks, Ryan, and thank you all for being here today. We want to be really focused on continuing to have collective conversations about how to move through this pandemic and into the rebuilding phase in a way that really supports the entire nonprofit sector. We encourage you, if you have any additional where to go from here insights, please feel free to share them with us at any time. Feel free to reply to us to let us know how you think we at CNE can and should be keeping this important community conversation, recovery conversation live. And I just want to sign off now and say thank you to all of you for your good community work.
Great. Thanks, Cristine, and thank you to our panelists, and thank you everyone for taking the time to join us.